So I'm assuming that all this stress can really have a serious effect on our health, right? Am I correct in assuming that?
Oh, absolutely. And it can lead to more serious problems. So when we talk about cardiovascular disease, so certainly it is statistically significant. And there's been epidemiological studies that have been done on the rate of heart attacks and what day of the week that it happens. And it's typically on a Monday.
Wait a minute, typically on a Monday, an actual day of the week?
Absolutely, and why is that? And there's a huge spike on Mondays because it's the beginning of the work week. And so typically with the stresses, we know stress and cardiovascular disease and having a heart attack is definitely correlated. And that stress, it's correlated. So again, as one of the stress-related health issues, it's so important that we deal with the stress first. It wasn't necessarily the cardiovascular disease. Yes, it could have been, the arteries could have been blocked because of stress and poor diet and lack of exercise and all those other, cofactors that go along with developing the actual MI or myocardial infarction. But it was the stress in the end that pulled the trigger to develop the heart attack. So we have to be mindful of these things, and that's why all the tools that we're sharing today in the show are so important to be able to deal with the stress.
Do you think being on Monday is partly because of what I'm doing Saturday night? And Sunday?
The hangover effect?
Right? And then Monday I'm up for work or up earlier than I have been in the last 2 days, typically? What do you think?
It may be. It may be part of, and the lack of sleep, which we talked about, and then that's, then the worried mind, and then maybe you can't sleep early on the Monday morning because that you've got things that are happening and you've got to get things done on that Monday. So it's a very, very common thing. So again, to be cognizant of that and to really take care of yourself, maybe prepping on Sunday to be ready for the work week so that that you go into it as gently and as easily as possible. Absolutely. Another one of the stress-related health issues would be stress disorders, so the anxiety, the panic attacks, and this is something that in my patients over the years is they think that they're having a heart attack, which is so disheartening. But for the fact that sometimes there's little to turn to. It's not like the medications are the answer, because they can really sort of cut you down in terms of your overall energy. So this is a huge concern. And again, I don't think I've ever seen a patient who just sort of started to develop panic attacks and nervousness and anxiety disorder. It was building up over the years, and because the stress wasn't managed in micro steps during the process of that surmounting and building up, because it wasn't dealt with, that's how it gets to the big panic attack. So this is why it's so important. If anybody's watching today, right, and they're listening and they're wondering about how to do this, recognize these things in yourself, perhaps that those little increments of stress are building up, and you don't want to get to that point of having the panic attack. Another one that's a stress-related health issue are the eating disorders. So definitely overeating is one, when we talked about Mr. Fat, right?
Mr. Fat.
And putting on that extra weight, but also undereating. So when you're stressed out and not eating, so they could both be equally as concerning for the overall health, and always finding the balance in our body. Another one would be the low levels. So the accumulation of the low levels of stress, so whether that's muscle aches, so people who have a lot of muscle aches, that could be an indication that stress is built up. And this is one of the things we'll ask our special guest about today, about the muscle aches and the pains and things, and with yoga, and how yoga can really maybe help to alleviate some of these, as much as we think that we're doing yoga. And this is something that we'll ask our special guest, who's coming up in just a moment, which I'm excited about.
Yeah, me too.
That the yoga can really be helpful at reducing that overall stress in the body, and then helping with the muscle aches and pains. Of course, headaches as well can be very much related to stress. IBS types of symptoms as well. So in the gut, the irritable bowel syndrome is very much stress related. And definitely the gas and the bloating and all those symptoms in the GI tract can be related to that stress. So I have a tip.
Okay, yeah.
So a tip for alleviating and for reducing the stress in the gut. So with the IBS symptoms, and it's called deep belly breathing. So we're going to put our hands on our guts and we're going to help to relax something called the enteric nervous system. So this is part of the autonomic nervous system. So there's a branch of parasympathetic and sympathetic. Parasympathetic is the more relaxed state. And we want to be in this more relaxed state when we're digesting our food, when we're not in that relaxed state. So let's say we're the grab and go, we're stressed out, we're eating and having a heated argument with someone, we're not relaxed, we're not centered, well then we're in the sympathetic part of our nervous system, which is the fight or flight response. And when we're in that mode, then all the blood flow isn't going to digestion, the blood flow is going elsewhere. It's going to our heart to help for us to run away from that stress, right? Yeah. That's the part of the sympathetic nervous system. Yes. We're also not secreting our digestive enzymes, so we have to be relaxed when we're eating. And no wonder people get IBS and all these symptoms of the gas and bloating in the stressed out state is because that blood flow is not going and those enzymes are not going where they're meant to into our digestive tract to help with digestion. So we're going to center in on that. So we're going to put our hands on our bellies.
Yes.
And we're just going to close our eyes gently. We're just going to take a few really deep breaths. And with the intention of helping our enteric nervous system, and with belly breaths, meaning that as we inhale, we allow our belly to expand. As we exhale, we allow our belly to fall. And just allowing for that parasympathetic nervous system to kick in, and it's that more relaxed state so that we can help with digestion. And this is for anybody who has difficulty with digestive issues, any type of digestive issues. I can almost guarantee that this is part of it, that stressed out response, and this can really help people without medication. You don't have to go anywhere, you don't have to pay any money, you're breathing. Yeah. But with the intention of helping to relax that enteric nervous system in the gut, you do that for as long as you can. I mean, ideally you do 15 to 20 deep, slow breaths with focusing that energy here. It can do wonders. And I've seen this in my patients, like turn things around in terms of their IBS symptoms. Yeah, in as little as a few days.
Amazing.
Because of that mindfulness and being able to center in on that. So I want everybody to try it. If they're struggling, with these symptoms of stress, especially in the digestive tract, that would be a great tip to do that.